So today we're going to be featuring another person from Healthy Partners, another doctor, as a matter of fact. And I have been very impressed with the doctors who work for Healthy Partners. There must be a beautiful screening process. So today we're going to talk to Dr. Gil Fernandez.
Hello.
And Dr. Fernandez is, as you can see, young, but he's high spirited. He's excited about working in this field. And I was talking to him a little bit, but why don't you just tell us about where you're from and a little bit about your family, Gil?
Hello, Anita. I was just telling you a minute ago, I look young, but I'm not as young as I look. I am originally from Dominican Republic. I was born and raised there. Full-blown Dominican. My mother is Dominican, but she grew up in New York City, and a lot of her family is in New York City. So I have a close affiliation to the States from an early age. Did my schooling there, and then after medical school, I came here for residency, and I have stayed here.
And is it very much different than living in Dominican Republic?
Yes, it is very different, completely different lifestyle, but like I mentioned, like we have a close affinity to New York Dominicans do. We grew up coming here all the time in the summertime, and my family will go there. Oh, but it is a very different lifestyle, yes.
And so how would you describe the differences?
Well, like, for example, I'm gonna give you a very good, I talk with my colleagues here all the time and they don't believe me. Like in the town that I'm from, we would go home for lunch at noon and everything would close at noon. You would have your largest meal of the day at noon and everything will stay closed until 2 p.m. So you would go home, have your lunch, have a nap, have some coffee, go back to work at 2. So that's a big difference between the U.S. and Dominican.
But how late did you work? Because I have been in Latin American countries, and then their offices are still open 6 and 7.
Oh no. But keep in mind that this is not the city. Okay, this is in the countryside where I grew up. It would be 8 to noon, and then 2 to 5.
Okay. And then do you have a big dinner too?
No.
No.
No big breakfast, no big dinner. It would just be a big lunch.
Right. So my guest is Dr. Gil Fernandez, and he is with Healthy Partners, and we're having some fun because doctors, everyone knows what the doctor is. You go there and, they have to ask you questions, but I always like to get to the other side of the doctor, because if you like your doctor, you're going to do what he says. If you don't, you're just going to pass it by. Let me ask you that. What do you do to get your patients to like you?
Well, I try to make the patient comfortable with where they are in their life. Try to get acquainted with them. I do not like to push. I am not a pusher for sure. I like to advocate for non-medicine therapies first.
Good.
And then I move on to medical therapy if they are unable to achieve their goal with just lifestyle changes. The other thing is that I try to educate the patient without being a cop on how the importance of controlling their conditions in order to prevent complications in the future. And most patients agree and they open their eyes when you tell them the potential consequences of not addressing their conditions now.
Yeah, that's really important, because I have said this to many doctors that people come to you and they're coming because they need something, but they're so excited to see the doctor that I've seen this with my own mother and people. How are you? Oh, I'm great. Everything's fine. Well, when they bring someone with them, the person will remind them, no, it's not so fine. Remember, you had this. So how do you get around that, Dr. Fernandez?
Well, that's also a good thing about being a family physician, primary care doctor, is that over time you establish a rapport with your patient, and obviously it may not be completely open the first time, maybe not the second, but by the third and fourth time that you see a patient, you get a good idea of where we are at. Also, when they bring in family members or friends to the office visit, a lot of times you learn so much from their family lives and their backgrounds, their culture, and you learn the things about your patient that you otherwise wouldn't have known.
And I'm sure that a lot of your patients are widows, widowers. Do you work with them in the sense, understanding that they're lonesome and that they maybe need a little bit of sympathy from you? How do you deal with that?
Whenever I identify a patient that may be in that circumstance, I try to schedule uh, more frequent visits,
Ah,
maybe shorter time, but more frequent.
mm-hmm.
That way they get to get out of their home, they get to come here and socialize, as that's very important at that age. They get to ambulate, they get to move out of their couches a little bit. And a lot of times they like that. They do, but a lot of patients in that circumstance, they do like to come see us and
So
talk to
you're
us.
very aware. That's good. I like to hear that from you. You are aware that that person, just because they're an older adult, they've had a big life and they have a lot of things that they need to talk to someone about. And unfortunately, sometimes they don't have family and won't talk to their friends, but they will talk to their doctors.
One thing that I like about Healthy Partners in Kano is that we have a very good system that notifies us as soon as a patient of ours is in the ER or hospitalized. So we get that notification the very next day. I see it on my screen that Mr. or Mrs. such and such was in the ER or hospitalized. And we make attempts right away to get a hold of them, figure out what's going on, try to get records from the hospital, and try to have them follow up with us as soon as possible so that there are no gaps in the care between the hospital and outside. You know that sometimes there are some tests that are done in the hospital that are not done until after the patient is discharged, and no one ever gets to see at this lab result or at imaging results because they didn't receive it until after the patient had gone already. So that's when we come in and we're able to see that those results and inform the patient. I'm like, your CT scan or your lab results showed this. Let's do this now. And that's one big thing that I like about Healthy Partners.
That's so good. I'm a gerontologist, so I'm having my hat on now, the gerontology hat, because I know that there are so many errors made in hospitals, unfortunately. And if doctors don't follow up, because you're the ones that would see what happened and then nothing happens. And I love hospitals for many reasons, but it's really a team approach.
Mm-hmm. Absolutely.
And so it's wonderful that you do stay on top, because I know you're very busy and I know that there are a lot of patients and all, but it's really important to make sure they're going to live to be 100 plus. I wrote a book called 100 Live to be 100 plus. So that's my goal for the older adults, to live a long time, but to live a healthy life. And if a doctor says, I'd like to see you lose some weight or to exercise, it means a lot more than if a friend or someone says it. The doctor is like, you're the God. And I've used this in a lot of my interviews. You can't help it. It's how they were brought up, especially the older adults. And so they respect that you like them, you want to help them, and if you'll do this the next time you come, and even if they've lost 3 pounds, as long as they're trying.
Absolutely. And I, like I mentioned a minute ago, I don't like to be a cop to anybody. But it is just by doing very, very small changes. And over time, you see big differences. I always tell patients, you did not gain 20 pounds in a month. You're not going to lose it in a month. It has to be gradual.
Okay, and so now my big question is, let's talk about a couple of things.
Yes.
People, and I'm guilty, don't drink enough water. Tell us the value of a lot of drinking water, please, for my benefit also.
So I always ask patients how much water they drink. Okay, I always do, especially when I'm prescribing a medication.
Mm.
Okay, and a lot of patients tell me, "Oh, I drink a lot of water. I drink 2 bottles a day." And I have to give them the news that 2 bottles a day is not enough water. So I understand where the patient is coming from. But most patients, as we get older, and I include myself, don't like to drink a lot of water towards the end of the day because we don't want to get up in the middle of the night to use the restroom, and that interferes with our sleep.
Well, just talk about why water is so important. I mean,
Yes,
I heard it, but tell us again.
So it keeps your kidney function adequately. You never know when you're gonna be taking a medication that would affect your kidney adversely. So if you're drinking water constantly, that will keep you a good kidney health. But also, just a little bit of dehydration can make you extremely fatigued, can make you dizzy, can make you more hungry. Maybe you think you're hungry, but in reality, you're just thirsty. So staying well hydrated is extremely important. Another way that I convince my patients to drink more water is talking about constipation. Mm. I mentioned constipation to patients, and all of lights are flashing. Right. And I just tell them, one of the best ways to prevent constipation, and no one likes to be in that situation, is drinking a lot of water. So I enjoy talking with my patients about things like that. Yeah. About fiber supplements, even if you're not constipated. I mentioned fiber supplementation to keep a healthy gut. Activity, ambulation, that also helps going and staying put.
I'm going to bring up a subject though, because a lot of people confide in me, and recently I had a female, an older woman, confide in me and her husband. She would like to have some marital sex, and he isn't able to perform, and so he's interested in Viagra. And she asked me what I thought. I don't know if Viagra is good, right, what it'll do for a man. I don't know if you're experienced. I mean, I'm sure you know enough about it. Could we kind of gently talk about it? Because it is an issue. If I go and speak to a crowd and they're kind of falling asleep and I start talking about sex, they're all awake. They all want to know all about everything they can. So what can you share about this, please, Dr. Fernandez?
Sexuality is very important in a human life, from the beginning all the way to the end. And it is very important in couples in order to have a healthy couple life. As being able to perform sexually for a man is very important. And if a man is unable to do so, doesn't feel he has the ability to do so, it will make the man refrain from seeking that intimacy. Just because you have the stress of not being able to perform. And not seeking the intimacy puts a strain on a married couple. Medications like Viagra, there are a lot of in that category, but medications like Viagra are very effective to treat erectile dysfunction as long as there are no contraindications from a cardiac standpoint. If your heart is strong enough to engage, is one of the best ways to approach this situation. If the man has something that will help them perform, it will not keep them from seeking intimacy.
Okay, so I do, and they do become depressed, and I understand it. So let's go back to that though. So they need a prescription for this, but
Yes.
what else would it refrain from? So you said heart condition. What else? What if someone's diabetic? Would that affect them?
Well, diabetics have very frequently have erectile dysfunction, not from a cardiac vascular problem, but also nerve damage. But just because you're diabetic doesn't mean that your heart cannot take it. So that doesn't necessarily keep you from taking that kind of medication now.
So you don't have any problem then if you've checked a person out. Then probably many men probably don't discuss this with you, do they? I would think that it's going to come from the woman, I think, rather, because the women are very vocal, aren't they?
Well, you'd be surprised.
Oh, okay.
You'd be surprised. But yes, the wife does come along sometimes and does bring it up.
Okay, and so you've made it very clear, and so, but and I don't think you can get it without talking to a doctor anyway first.
No,
So,
absolutely. That kind of medication is prescription because it does have some contraindications, like I mentioned, and some safety concerns. You have to educate the patient on how to properly take it, when to take it, what signs to look for if you develop any adverse side effect from the medication. One big one that we always have to educate the patient on is on taking nitrates. I don't know if you've seen the movie Something's Gotta Give with Jack Nicholson.
yes, I did. And what? Go ahead.
So he took Viagra and he goes to the hospital with chest pain because he thinks he's having a heart attack. And the doctor asked him, "Have you taken Viagra?" Because they're gonna give him a medication that interacts with Viagra. And he's embarrassed to say it in front of the lady that he's dating.
So you have to be very honest because there can be other problems. They'll give him too much, is what you're saying.
Yes, you have to always disclose to the patient that if they go to the ER with chest pain, they should tell the doctor that they have taken this medication. Although most of the time, doctors, we do ask if the patient has, but you know how hospitals are.
Yes. Okay, well, thank you. That was a very good explanation. This is Dr. Gil Fernandez, and he is with Healthy Partners, one of their family practitioners, and we're very happy to work with them. I want to continue with medications, though.
Yes.
Medications are very serious for older adults, and sometimes they don't remember what they've taken. They don't take it correctly. How do you deal with that?
So one of the things that I try to have my patients do is always bring all of the medications with them at every visit. It's hard to get to patients to do that. I have my front desk and my medical assistants always remind them when they book the appointment to tell them. And I tell them, next time you come in, please bring all of your medications with you. And every time I go through each of the bottles that they're on, and I compare it to the ones that I have on their charts, because very often you find discrepancies between the two. Sometimes maybe another doctor has prescribed something else that we didn't prescribe and they didn't mention it to us, So I go through those through their medications with the bottles every time, and we print out the list of the medication and just so that they know. But it's very important. Sometimes you have patients that are taking the same kind of medication that they had from a previous doctor,
Yeah.
They just have the bottle, and until they actually bring you the bottles, you don't know.
Ah, that's a very good point. And the other thing is, you're going to laugh at this, but sometimes they get their medication from their friends because they ran out or something. And I mean, that's terrible, but I guess you go through all that, I hope.
Oh yes, 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 and we see that a lot, taking medications from friends or relatives, but also with antibiotics, we see that. Oh, I had amoxicillin from last year, and you have to, you at that point you take 2 minutes aside to discuss the importance of not taking old antibiotics.
Right. So there are a lot of situations, when you went to medical school, I hope that they went through all this because a lot of these things are social. These are, a social worker understands a lot. A lot of time doctors don't seem to have the time to get into these issues, but I think it's extremely important.
family Family physicians and internists, I think that we're very I think that we're good at this, just because we are trained, um, to see the patient as a whole, rather than just focus, like special. And I don't like to bash specialists, by the way, but the specialist is just focused on that particular issue of your body. We are seeing you as a whole, and it gives us the opportunity to and the luxury to be personal with the patient. I think that we develop that as we go. It gets better, us picking up on small things.
Right. Well, the last thing, because I don't want to run out of time here, is the the people who do come to you, they want to really stay with you. They don't want to really leave. Unfortunately, sometimes insurance makes them leave, and I hope that doesn't happen because people just have to stay with their doctor. That it's like their friend. It's like, he knows everything about me. I don't want to go anywhere else. So I'm always telling people, make sure wherever you go that that's the doctor and you can stay with him.
We have a lot of patients who establish care with us because of that. Like, oh, my doctor no longer accepts my insurance, and it's unfortunate. Really, it is an unfortunate reality that we live. I have been doing this. I graduated from residency in 2009. Okay, so I've been doing this over 10 years now, and I am still unable to understand the process of insurance companies not covering this physician versus this physician.
I know.
I understand maybe specialists in a hospital setting, but a primary care doctor, we're primary care doctor, but why not cover me and cover this other gentleman here? It is a detriment to the patient.
And before I let you go, I didn't do this. I went to the beginning. When did you decide you wanted to become a doctor? You're a little boy.
I have to be honest with you. I always knew that I wanted to be in medicine.
Huh.
Um, just because of the fact that I enjoy taking care of patients, especially the elderly. I was very close to my grandmother.
Ah, that always comes up. You're very close to your grandmother, right?
Always close to my grandmother. My grandmother was a diabetic.
Ah,
She was not very adherent to her medications. And I didn't know at that time. I did not know at that time. I was just a child. The importance of taking her metformin every day. I thought that metformin was a as needed medication.
mm,
And she did pass from a heart attack at a young age of 72. And that really just really affected me.
hmm.
Something simple that we could have prevented,
So now everybody's your grandmother and you're just so good to everybody. And you know, Dr. Hernandez, this has been wonderful talking to you. And I hope I get to talk to you again. You're charming. I can see why your patients like you. And I want to say thank you again for what you did. And
Oh, thank you, Miss Anita.
yeah, thank you.